All right. If you're gearing up for a healthcare exam, you know that urinary elimination care is a topic that's absolutely going to be on it. So let's cut right to the chase and focus on the must-know essentials that'll help you ace those questions.
Let's jump right in. We're going to cover the core ideas, the key numbers, and the critical safety rules that are almost guaranteed to pop up on your test. Seriously, think of this as your high-yield study guide. All the important stuff, no fluff.
So here's our game plan. We'll kick things off with what normal urination looks like. Then we'll tackle incontinence, get into the different types of catheters, master catheter care, cover a couple of key procedures, and then wrap up with your professional responsibilities. Let's do this.
First things first, you have to understand what's normal. Why start here? Well, think about it. How can you possibly spot a problem if you don't know what good looks like? This is the foundation for pretty much any assessment question you're going to get.
Okay, here's your first number to burn into your brain, 1,500 milliliters. That's about how much urine a healthy adult makes in a day. Now, of course, that can change depending on how much they drink, but 1,500 is the magic number, the benchmark you need to remember for your exam. And this is your quick, at-a-glance assessment. You're looking for three things right away: color, clarity, and odor. Should be pale yellow to amber, it should be clear, not cloudy, and it should have just a faint smell. If you can tick all three of those boxes, you're looking at a normal, healthy sample. And on the flip side, here are the major red flags. I'm talking absolute deal breakers. If you see blood that's called hematuria, or if it's cloudy or has a really foul odor, you've got to report that immediately. Same goes for when a patient tells you they have dysuria, pain, or burning. You've got to know these terms. They are classic exam material. Okay, so we know what's normal, and we know what the big warning signs are. Let's move on to managing urinary incontinence. This is something you will see all the time, and handling it the right way takes both skill and a whole lot of compassion. The definition itself is so important. Incontinence is the involuntary loss of urine, but pay close attention to that second sentence because it's a huge misconception and a very common test question. It is not a normal part of aging. It's often caused by something that can be treated. When you're caring for a client with incontinence, it really boils down to three main goals. Goal number one is safety. You want to prevent infections and skin problems. Goal two is comfort, just keeping them clean and dry. And goal number three, which is always there, is dignity. You have to provide a respectful care every single time. All right, let's get into the hardware. Urinary catheters. These are really common tools, and for your exam, you absolutely need to know why they're used and what the key differences are between the main types. You know, catheters aren't just used for convenience. They have very specific clinical purposes. You'll see them used after surgery, for clients who are too weak to get up, or to protect a serious wound from getting wet. They're also used when someone has urinary retention, meaning they just can't empty their bladder on their own. Now, this is a classic exam comparison. A straight catheter is what we call an in and out catheter. You put it in, drain the bladder, and take it right back out. An indwelling catheter, or a Foley, is different. It's designed to stay in place, held there by a tiny inflated balloon, so it can drain urine continuously. So just think, temporary versus continuous. That's the main difference. And here's another really important one. An indwelling catheter is invasive. It actually goes inside the body. A condom catheter, on the other hand, is totally non-invasive. It's an external device, basically a sheath that fits over the penis. This makes it a great option for incontinent men because you can manage leakage without putting a tube inside them. Okay, listen up. If you're going to remember one section for your safety questions, this is it. Managing an indwelling catheter is all about following some very strict rules to prevent really serious infections and injuries. This is the golden rule, the number one, non-negotiable, most important rule. The drainage bag must always, and I mean always, be kept below the level of the bladder. Why? It's simple gravity. You don't want old, potentially germy urine flowing back into the bladder. That's a one-way ticket to a nasty infection. So let me hit you with a direct question, just like you'd see on your test. Knowing that rule, what's the one place on a client's bed you should absolutely never, ever hang that drainage bag? The bed rail. That's the answer you need to know. Never, ever hang it on a bed rail. Why? Because bed rails move up and down. If that rail gets raised, the bag goes up with it, and suddenly it's higher than the bladder, and you get backflow. It has to be secured to the stationary part of the bed frame.
And here's another little detail that's super important. Don't wait for the bag to be completely full and bulging. The rule of thumb is to empty it when it's about 2/3 full. A super heavy bag can pull on the catheter, which is really uncomfortable, and it also increases other risks. All right, let's quickly run through 2 more hands-on skills that you'll definitely see questions about. Examiners love to test you on the correct sequence of steps for things like bladder training and collecting a clean urine sample. So, bladder training is all about helping a client get back some control. You've got 2 main plays in your playbook here. The first is scheduled toileting. That's a fixed schedule like clockwork. Every 2 or 3 hours, it's time to go to the bathroom. The other is prompted voiding, which is more interactive. You're regularly asking, hey, do you feel like you need to go? And encouraging them to try. The whole point of a midstream or clean catch specimen is to get a sample that isn't contaminated by germs from the skin. The process is key. The client starts urinating first to flush everything out. Then they stop the stream, and then they start again, but this time into the sterile cup. Just remember, start, stop, collect. That's the sequence for a perfect sample. And that brings us to our final section. We've talked a lot about the technical stuff, the what to do. But being a great healthcare professional, well, it goes way beyond just following the steps in a textbook. It's all about how you do it. And this right here, this sums it all up perfectly. Every single thing you do, whether it's emptying a drainage bag or helping someone to the toilet, has to be done safely, effectively, and always, always with respect for that person's dignity. So as you walk into your exam, keep this in your head. The procedures, they're the what. But the how? That's what makes the difference between just being competent and being a truly great caregiver. The real test isn't just knowing the rules. It's about figuring out how you're going to make sure every single client feels safe and respected, even in their most vulnerable moments. If you can answer that, you're not just going to pass your exam, you're going to be the kind of caregiver every patient hopes for. Good luck.